everybody, and welcome back to Test Don't Guess Tuesday. I'm your hostess, Melissa Hall-Klepacki, functional gut health expert, and I take a look at GI map testing all day long and tell you a little bit of a case history and what we did to get the client over to the other side of healing. So this week is an interesting case. This was someone who sent me their GI map test. So it wasn't a test that I had ordered. In fact, it was a mom that I was in conversation with who had convinced their dermatologist to order the GI map for her son. Here's why. She had heard people talking and saying that all health begins in the gut, and that the skin is a direct reflection of the gut. Both very true. And so she did her research, she wanted the GI map, and she pushed to have the dermatologist order the GI map. However, when the test came back and there were red flags, and you'll see there are many of them, the dermatologist was like, okay, well, I ordered the test, but I don't really understand what to do now with this result. So they called me. I was happy to read through the test, take a full history on the child, who happened to be a 16-year-old boy who was having 6 to 8 bowel movements a day, lots of cystic and just general acne on his face, on his chest, on his back, on his shoulders. So a lot of stomach pain, and a little bit of acid reflux, just not digesting food well, scared to eat lots of different foods, kind of was a really basic, bland eater, and just dealing with horrible skin conditions, and his mom was at her wit's end. So I want to go through the GI map with you. I want to show you what we found, and how we prioritized and what we did to get this boy feeling and looking a lot better. So here we go. Okay, so this was his GI map test. For anybody not familiar with the test, I want to review really quickly. On the left-hand column is your bacterial pathogens in a list. In the middle is the result of the client, and on the right-hand side is the reference range. So what they're saying is any number over our reference range, we're going to consider high, and you should consider it perhaps a source, a root cause of the symptoms. And so you'll see sometimes that results are higher than under the detectable limit, which is what DL stands for. However, they're not lit up in red because they haven't reached over that reference range. And remember, this is a very specific test that's looking for the DNA of these bacteria. So it's going to pick up tiny, teeny little bits. However, in this case, you'll see C. difficile, toxin A, and toxin B were both very high for this client. That would be one of the sources, as we get into this test, you'll see, for those bowel movements 6 to 8 times a day. C. diff is a very toxic bacteria that causes people to have generally many bowel movements, a lot of times liquid diarrhea, a lot of times really foul smelling, and also highly infectious and contagious. So when we saw this, we did have a talk with the family about putting the son in one bathroom. He was using the powder room and nobody else was using it, just as we were dealing with this infection so that nobody else got it. You'll see that everything else here on this first page, from bacterial pathogens to parasitic pathogens and viral pathogens, all were negative. So we'll move on to page 2. Here you'll notice that the H. pylori is high, right? 1.13 e to the 3 is just over the limit that puts it in the red. H. pylori is a bacteria that infects the lining of the stomach. It often causes lower stomach acid. It can, for many people, be the beginning of of constipation, because of lowered stomach acid. However, this patient had diarrhea, not constipation. So in light of seeing the C. diff numbers really high on the first page, already in my mind, this H. pylori infection is going to take a back seat, and most likely, whatever we're going to work through with a protocol that's going to take care of that C. diff and some of the other bacteria I'm going to show you, will most likely eradicate or really lower this number of H. pylori. We move on to the next section, commensal and keystone bacteria. You'll see here a list of bacteria that we know need to be in the gut in those green levels in order for the gut to function properly, in order for us to feel our best. And actually, he's not doing such a terrible job. You'll see that almost every bacteria level, besides Akkermansia and Faecalbacterium prausnitzii, are doing really great. Akkermansia is undetectable, and that's a problem because that bacteria helps us to retain really good cell integrity in the intestinal lining and keep that lining intact. That bacteria will eat away at the mucus lining in order to have it continue to regrow. Without that, we suffer from leaky gut. Remember, leaky gut is when the spaces between the cells in the gut become too big and food can get in the way, get into the bloodstream, cause autoimmune issues, etc. So we want to make sure that Akkermansia level is nice and robust. We can do that with a great supplement by a company called Pendulum called Akkermansia. And that is exactly what we did for him for that level. You'll see Faecalbacterium prausnitzii is also slightly low, and a lot of my patients respond really well to eating kiwi fruit. So 2 kiwi fruit a day, a couple days a week, will often over time bring that level up. Remember, we should be getting our fiber and all these bacteria from food when we can, but when we need to supplement with supplements, that's what they're there for. You'll see in the next section, bacteriophylla. It talks about gram-positive and gram-negative bacteria in the gut. You'll see that his Firmicutes is on the low side. However, what we pay real attention to is that bacterioides to Firmicutes ratio, and here he is doing just fine. We can take a look here at the overgrowth of bacteria. So you'll see that both the Enterococcus is high, as well as the Streptococcus, very common bacteria that we find in the gut. A lot of times when we have lowered stomach acid, right, some of that bacteria makes its way through the gut and can start an overgrowth pattern in the large intestine. So again, we're thinking, as we are thinking about what will knock down the C. diff, maybe the H. pylori, what also could handle the Enterococcus and Streptococcus. Those are the things I'm thinking about when starting to put a protocol together. You'll notice that the next section, commensal and overgrowth microbes, while not in the red, both are creeping higher, and that would explain some of his bloating. A lot of times when we see bloating in the small intestine, we see these numbers creeping higher. So again, something that would help us knock those down would be super to add to his protocol. But then we have a hard stop. When we get to this section of inflammatory and autoimmune related bacteria and the one below it, commensal inflammatory and autoimmune related bacteria, and these light up like this, that's where our whole focus begins. Because these bacteria can release lipopolysaccharides that have long-term health effects. They can cause autoimmune diseases like lupus and rheumatoid arthritis. And so we want to find something that's going to knock down the Citrobacter and the Proteus. And for me, a lot of times it starts with the essential oil of thyme, which is very powerful in the digestive tract. A lot of the modern herbal blends will contain thyme, and that is exactly what I chose for him. And we'll talk about that once we get through the next page, but you'll notice and want to remember how high these numbers are. And then you can see this was a photocopy or a picture of their test result, so it kind of got smeared, but the candida levels and the fungi and yeast are all normal, as well as the viruses here. This is the last page. Parasites all normal, worms all normal. I remind you that even though these are normal, a lot of these patients and clients do have parasites, and when we embark on a parasite cleanse, we find them. That said, intestinal health markers is one of the most important sections of this test, and it just tells us how we're processing food. So our digestion, we look at steatocrit and elastase 1. Here you'll see his numbers are perfect. It makes me less worried about H. pylori when we know he's digesting food well. GI markers of beta-glucuronidase and occult blood, also beautifully normal. Secretory IgA, this is talking about how his immune system is responding. Anti-gliadin IgA, is how he's reacting to gluten. And you'll see this number While in the green, it's higher than I'd like it. So one of the things I wanted him to do when we worked together was knock off gluten. Gluten and dairy had to go, especially with the acne. So he cut out gluten. Eosinophil activation protein also is talking about immune response, and here you'll see that that's high. So something to keep in mind. Calprotectin level of inflammation, not so high and not so worrisome, but you'll see the zonulin level, which talks about leaky gut. And we talked about that when we saw the akkermansia. Remember, I explained that that bacteria is responsible for eating away at the gut lining, that mucus lining, so that it replaces itself and creates a nice, healthy boundary. When that doesn't happen, we see the zonulin level rise as we see leaky gut. So let's talk about what we did with him. All right, I'm going to run you through the protocol. I, of course, used Akkermansia. We talked about this, and I apologize that all the labels are backwards, but this is the Akkermansia probiotic that would help him to replace that in his gut. I also used products from Biocide and Botanicals. They have a gut reset program, essentially. And so it contains, starting with their Biocide and Botanicals drops. This is something you start slowly with, you titrate up. I start people between 2 and 5 drops, and then every day try to get to 15 drops 3 times a day. That's the dosing for that. And contains lots of essential oils and lots of nutraceuticals that are going to help to take some of those levels down. We did this with him for two and a half months, and then we moved on to the liposomal version. So this really is going to stay in the GI tract, the drops. But once you go with the liposomal formula, you're really taking it throughout the body. And so we wanted to do a big cleanup. After we got through about 2.5 months of this, we started using this, and this is the same. You pump it under the tongue. I think we worked up to 3 pumps 3 times a day. So that's the Biocide, and that is the same ingredients, but a liposomal version. We also use that alongside their Olivex product. This contains olive leaf and a proprietary herbal blend. Again, just giving a little bit more juice because we were really worried. There were a lot of markers that were off. Always, when we are killing something in the body, 2 things need to happen. 1, we need to be pooping really well and every day, which he obviously was eliminating often. And the second is we use a binder. When I use these products from Biocidin, I also like to use their binder. This is the GI Detox binder. It's a blend of chlorella, apple pectin, charcoal, zeolite clay, aloe vera leaf extract. This stays in the GI tract, and that's exactly what I want it to do. I want it to help to pull all those dead bugs that we are killing with the Biocidin out into the poop and out the body. And then we also added in their Inner Calm just to restore some integrity to his gut, right? A lot of healing needed to happen there. So we use their Inner Calm product. You just mix this with water once or twice a day for gut healing. We worked with him for 6 months. 6 months to heal his gut so that he was pooping normally once a day, sometimes still on the looser side after 6 months, but it definitely wasn't 6 to 8 times. His skin cleared up tremendously. His chest and shoulders cleared up first, his face cleared up next, and he did have some upper back acne that he is continuing to work on. And he is continuing to pulse dose some of these products. You can imagine a 16-year-old staying on a protocol for 6 months was tons of work for him. Kudos to him for sticking it out. And I think he started to feel better and better. And when you feel better, you continue doing what you're doing. And so the power of healing the gut to get through the skin is undeniable. If you have a teenager that's dealing with severe acne, you might want to run a gut test on them. And you can do that over at digestivediscovery.com. That's my website. It's my back-end portal with lots of information there, recipes, etc. But the most important thing is a test will get sent to your house. You do that in the privacy of your own home. You send it back, you get the results. You'll get the same results you were looking at today, the same test results. Obviously, your results will be your microbiome. So if you have questions, please reach out. I'm here to answer them. I'm hoping that you take your gut health seriously because that is where your health starts. Thanks for joining me. I'm Melissa Hall-Klepacki. I'm here every week with Test Don't Guess Tuesday. I'll see you next time.